Hello, beautiful people. Welcome back. Another day. Today's date is Thursday, April 23rd, 2020. Back for another daily Rona report. I gave a little background information about myself yesterday. Quick update. Name's Jordan Taylor, student from Eastern Kentucky University, currently living in Richmond, Kentucky. So these podcasts, for those that didn't watch yesterday, are kind of just like a quick rapid fire of what's going on, how many cases in Richmond, how many deaths, and then Governor Beshear, or Uncle Andy as we like to call him in Kentucky, uh, what numbers and developments from his um, daily press conference about coronavirus, and then President Donald Trump's press conference and the White House's press conference as well. So, like I said, just kind of like a quick rapid fire, try to give you all the uh, important information and statistics. Let's jump right in once again. So, first and foremost, we'll do the Richmond. So, get you guys the capture here. So, as you can see, Richmond, still the same number as yesterday for those that watched. Still 23 confirmed cases, one death in Madison County. Fayette County, which is the closest major place. That's Lexington, where I work, Lexington, Kentucky. So Fayette County, still 223 confirmed cases with 8 deaths. So that's the numbers there for that. Jumping right into things. So I want to go right into the main thing that Governor Beshear, Uncle Andy, talks about every day, the top 10 steps to fight COVID-19. So as you can see here, stay healthy at home is one that he strongly stresses every day. So, leave only for essential items, groceries once a week, medical supplies, medical treatment, things like that, or work if you're still working. I myself am not. It gives me more time to do videos like this. Also avoid crowds and gatherings. The CDC has issued like no more than 10 people should be in a place. But today, one thing that Governor Beshear talked about was how that avoid any crowd of any size, including home visits, recreational areas, crowded shopping, like just don't be in a crowd, period, was one thing he was stressing. Also practice social distancing. So maintain that 6 feet between you and others. Know when to seek care. So if you feel sick, if you feel like you have symptoms, then you should probably go see somebody about that. Call ahead of time though, because if you don't necessarily have the coronavirus, you can talk to someone over the phone and you may prevent the spread of the coronavirus more just by staying at home. So definitely call ahead of time, but seek that care, do the telephone, and then when needed, make sure you get tested and uh, get the treatment you need if you are in fact infected with the coronavirus. And then also stay up to date through reliable sources such as kycovid19.kentucky.gov or .ky.gov. Another one is govstatus.egov.com/kycovid19. And for those that didn't watch yesterday, I will once again have any website that I list. Links will be down in the description below for this YouTube video, so you can click those there and get to the sites that you need to. Also want to wash hands and surfaces, use soap and warm water, wash hands for at least 20 seconds. Also frequently disinfect regularly used surfaces. So any area that is touched by you or others frequently, you want to disinfect that. If you're staying at home, obviously, especially if you live by yourself, you can't, spread coronavirus to yourself. But if there's others coming in, if you're going somewhere where other surfaces or where other people are touching, you want to disinfect those frequently. And then, of course, if you are laid off from work or you're losing hours, you lose your job because of COVID-19, you definitely want to apply for benefits. The unemployment benefits have been expanded, so you make sure you want to apply for those benefits so you can still have some money coming in. It is a little bit stressful. I can definitely relate since I have been laid off about a week and a half ago. Uh, it's definitely stressful. The unemployment right now. There's a lot of people out of jobs trying to get that unemployment. Just breathe. As Governor Bashir says, we'll make it through this. We'll make it through it together. So just try to stay positive. That goes to the next point. So prioritize mental health. You know, seek out some virtual social opportunities. Try to FaceTime or video chat with friends and family to maintain positive spirits. Go outside. Practice social distancing, but go outside and get some physical exercise. Enjoy the nice weather. Obviously, today it was rainy, but you want to, when it is nice outside, get outside, practice social distancing, but still, enjoy the weather so that your mental health is still prioritized and you're still maintaining a positive outlook. Also, obviously, do not travel. Safest place for you and others is at your home. That's what he's been saying all the time. Uh, so just stay at home unless you have to. Um, Need some groceries, things like that. Obviously, go get them. But don't travel just to be traveling. That's pointless. So don't take a drive like, well, let me just drive to Tennessee. Well, when you come back, you're going to be stuck in self quarantine for 14 days. But shouldn't be doing stuff like that. We want to prevent the spread so that we can get things back to normal. And then you can report noncompliance by the Kentucky Safer hotline at 1-833 Kentucky Safer. So those are the top 10 steps to fight COVID-19 that Governor Bashir starts with every day. So I'll probably start with those every day too, just because he does. Get the Kentuckians those steps every day. Another thing that he talked about today was filling out the census. Here's a list of how to respond. You can do it online, by phone, or by paper. Should be something sent to your mailbox at your home address that you can fill out and send back, or you can go online, or there's a phone number that you can call. Governor Bashir stressed this, that Kentucky right now is ranked 16th nationally in terms of completion, but Oldham County is in the top 10 counties nationally. So he gave a shout out to them for completing theirs very well. And then he also said that 2 cities in Kentucky were in the top 10 nationally in terms of completion as well. So for those that don't know the website, it is 2020census.gov. That'll be down in the description below as well, so you can check it out there. Another thing that Governor Bashir talked about was testing for COVID-19. So the drive-through testing is still somewhat relatively new, something that he's strongly suggesting just because it's less contact, don't risk spreading it to others as much. But through those drive-through tests, he said that there was 1,009 tests completed today, and this week alone there was 2,622. So that's Monday through Thursday, 4 days. That was as of 4 p.m. today, though. So obviously the number will be a little bit bigger than that for the numbers for today, but that was as of 4 p.m. today. Those, as of right now, everything has been through Kroger. These are the new sites that he talked about yesterday. I also talked about them, but here are some more details on that. So everything so far has been through Kroger. There is a new partnership with Walgreens starting tomorrow, Friday, April 24th. But everything's been through Kroger thus far. These 4 new sites are through Kroger as well. As you see down below, you can go to krogerhealth.com/COVID testing. That's actually going to take you, you will actually be like rerouted to the littleclinic.com/drive-through-testing. So that is the link that I have below. So it'll get you straight to that site. But these are the new testing sites that will be opened. So Louisville and Lexington, they will be open starting on Monday. It's Shawnee Park and then Bluegrass Community Technical College. As you can see there, 500 Newtown Pike, obviously 4501 West Broadway for Shawnee Park. Those will both be open starting on Monday, April 27th. They'll be open Monday through Friday from 8:30 a.m. to 5:30 p.m. And then in Owensboro at Davis County Owensboro Community College, that one opens on Tuesday, It's open Tuesday, Wednesday, and Thursday. And then Bowling Green, the same thing. Open Tuesday, Wednesday, Thursday, starting next Tuesday. That one's at Warren High School, South Warren High School in Warren County. All of them open 8:30 to 5:30. Excuse me. And something he talked about yesterday, before there were guidelines and requirements that you had to meet to be able to register for this test. As I said, you have to go to that website, thelittleclinic.com/drive-through hyphen testing, or the Kroger, let me look at it again, krogerhealth.com/COVID testing, which will reroute you to that thelittleclinic.com. But you have to go to those to register for that drive-through testing. Before, you had to meet eligibility requirements, but now the Kroger testing sites are open to anyone. Anybody can go register and go get a test. You don't have to have symptoms. You don't have to be in a vulnerable population. You just sign up on that website. They'll give you a date and a time. Go drive through, get tested. You'll find out your results. I believe most of them are 48 hours now, but it should say on that website for sure. Give you more details on that. So I talked about a new partnership with Walgreens. Here's that. This one actually opens tomorrow, Friday, April 24th. It is in Lexington on Executive Drive, 2296 Executive Drive. It's open 7 days a week, 9 a.m. to 5 p.m. Eastern, but it is only open to healthcare workers or first responders with or without symptoms, or individuals 18 and older with symptoms. So if you have symptoms, you can go to this one, or if you're a healthcare worker. That's the only people this one is open to. It's open 7 days a week, 9 to 5. You can go, as it shows there, walgreens.com/coronavirus. I will have that in the description below as well. So look down there and you can get that website. Another thing that Governor Beshear talked about today was the Healthy at Work .ky.gov. So he talked about opening the economy back up. For those that watched yesterday, I talked about how Kentucky was kind of plateauing. So in terms of how many positive cases we have, we're no longer increasing like a bunch more each day. We're kind of plateauing right now. But in order for the economy to fully open back up, I talked about those benchmarks yesterday, but one of the main ones is that we have to our cases need to be a decrease. So say there's 600 cases one day, then 500 the next. That's technically a decrease. So that has to happen for 14 days before the economy can start opening fully back up. But when it does, Governor Beshear wants, as of right now, he wants, for all industries, just go to healthyatwork.ky.gov. That's going to be down below as well. Submit guidelines and regulations for all types of industries, like what you think good guidelines and regulations should be for when the economy does open back up. And he did state that right now these are just submissions and suggestions, but once they get a good understanding of what every industry should do, they will be mandated. They will become mandated once they're finalized. So if you have any ideas about that, just go to that website. It'll be down below. Submit those guidelines for that. So a big thing from Governor Beshear's press conference today, actually what took up a majority of the time, he talked about how in response to opening the economy, he's going to start with the healthcare first. That's going to be going into effect Monday, April 27th. So pretty soon they actually had some like in detail of what that it's going to be phased and gradual. So the first phase, you guys see me looking down. Got to look at my notes to make sure I don't mess anything up here. But starting Monday, there will be a resume to non-urgent and emergent health care. So healthcare clinics, medical offices, physical therapy settings, chiropractic settings, dental offices, which are going to need enhanced PPE or personal protection equipment, and optometry as well. He strongly said that promote telehealth over in person. So if you can do stuff over the phone, then do that rather than being in person. And then there's going to be still no visitors except when necessary. So, like if it's a child that needs a parent there, or someone is dying and then the family can come visit, things like that. Other than that, there's going to be no visitors allowed. There's no waiting room. So, the waiting room is basically going to be your car. Uh, Probably going to be issues where you call and say, okay, I'm here for my appointment. They'll tell you to wait in your car. You will get a call back when it's time for you to come in. Things like that. So, no waiting room. Still going to need to maintain social distancing, so 6 feet between people. Also, everyone entering the building is going to have to be screened. So, you're probably going to have to take temperatures, answer a survey to talk about if you have any symptoms, things like that. Then also, there is every office that opens back up for this medical phasing, gradual reopening, has to have the necessary sanitizer and personal protection equipment. So, like masks, everyone working and the patients coming into these facilities have to wear those masks. For high contact facilities, so like physical therapy, where you're touching the patient, the people have to, there has to be physical contact, chiropractic facilities, things like that. He said that non-latex gloves, this was a big one, was non-latex gloves have to be worn, and then anything that a patient touches or is used to touch a patient has to be sanitized between patients. So, like each patient that comes in, they're going to have to sanitize everything that patient touches or they use to touch the patient, whether it be like some kind of instrument or whatever. They have to sanitize all of that and then wear non-latex gloves that also have to be uh, thrown away and then a new pair put on between each patient. For dental facilities, because he talked about how like there's a lot of like aerosol risk where they're like blowing the aerosol into a patient's mouth, things like that. It's a lot different because the coronavirus can be spread. Obviously, when a patient's getting like using those things into their mouth, you can't necessarily put a mask on them. Can't really do that through a mask. So, uh, did state that they are right now looking for enhanced protection suggestions from professionals in the dentist field. So they're looking for people in the dental field to submit how they can help deter the spread of the coronavirus while still being open and completing the things that they want and need to do for their patients. Also stated that long-term care is not reopening, but they are actually becoming more scrutinous because other things are opening. So let me see, I actually have that for you as well. So long-term care facilities, nursing homes, things like that. This is some of the stuff they're kind of doing. So they're encouraging all residents to wear masks to reduce the spread, cancel communal dining, social activities, limit the movement of residents around the facility. They're minimizing entry into the resident room by bundling care and treatment activities. The non-essential personnel, so volunteers and visitors, are not allowed in the building. Cannot go into these facilities. And then they're also wanting to take temperatures daily and make sure, check for shortness of breath, cough and sore throat, things like that. And then there's a low threshold to transfer the ill, so residents to a higher level of care. So they're in the long-term care facilities. We'll get to the numbers. You've seen them on that at the beginning of this video. We'll get to the numbers of how many deaths there are total in the state of Kentucky, but 86 have been at these long-term care facilities. Obviously, elderly are more vulnerable to COVID-19, but 86 is a little less than like 45% in terms of the total deaths. So makes sense why they're being more scrutinous in their approach. So now that we have touched on all that, that's a majority of the main developments from Governor Beshear's press conference today. So we'll just get into the numbers now for Kentucky. So in Kentucky today, there was 161 new cases. That brought the total to 3,481 total cases for the state of Kentucky. there have been over 42,000 people tested. So it's a pretty good number considering 42,000 people have been tested. Only a little less than 3,500 have been confirmed to have the virus. Now, obviously, we got to keep practicing the things, stay healthy at home and these things to keep that number that low, because the more you get out, the more you can spread the virus, and then there's going to be more people tested positive. So, as of right now, 302 people are hospitalized with the coronavirus in Kentucky, and there were 6 new deaths today for the state of Kentucky. I talked about how 86 deaths for nursing homes. There have been 191 total in the state of Kentucky. So that's why I said like 86 out of 191. That's a big amount for these long-term care facilities. So it makes a lot of sense for them to be pretty strict on how things are maintained. However, good news, there have been 1,335 Kentuckians that have recovered from COVID-19. So that's a pretty good number as well. For for full updates and details, I gave you the websites there. They're down below as well for Kentucky, so you can definitely check out those. So now we will rotate a little bit, get into what went on the national scale. So the first thing that Trump talked about was that he expected the House to pass the Paycheck Protection Program and the Healthcare Enhancement Act. Both of these, he said it was $320 billion in financial relief and support for American workers and small businesses. So just give you a little detail about those. The Paycheck Protection Program, it's basically a loan that is designed to provide a direct incentive for small businesses to keep their workers on payroll. So it will, the loans, from what I understand, I just tried to do a little research on it. The SBA, or Small Business Association, they will forgive loans if all employees are kept on the payroll for 8 weeks and the money is used for payroll, rent, mortgage, interest, utilities, anything like that. And then it said that lenders may begin processing loan applications as soon as April 3rd. Obviously, that's already passed. And the Paycheck Protection Program will be available through June 30th, 2020. So those small businesses can apply through any existing SBA 7 lender or through any federally insured depository institution, federally insured credit union, Farm Credit System institution. Other regulated lenders will be available to make these loans once they are approved and enrolled in the program. So basically what Trump was hoping the House would pass, it's already been passed through the Senate. So he's hoping the House will pass it so that it can be signed into law. Right now it's just a bill, but this bill for that Paycheck Protection Program is just more money to go towards those loan applications. As for the Healthcare Enhancement Act, just a little background on it. So it's basically, it's additional money to go towards the same thing that went towards the CARES Act, which was originally $100 billion was appropriated for that. It's for the Public Health and Social Services Emergency Fund of the Department of Health and Human Services. It's a relief fund for reimbursement to eligible healthcare providers for healthcare-related expenses or lost revenues that are attributable to the coronavirus. So anything that they've had to pay more money for because of the coronavirus, or anything that they've lost money on that was due to the coronavirus, this is just some money to help negate or balance out those expenses for them. So that was the first thing he talked about when he came out today for the White House press conference. Um, then he also it was also talked about how the New York metro area, New Jersey, Connecticut, Detroit, and New Orleans are all past their peak. This was Vice President Pence that talked about that. He also said that he believes by early summer we'll be in a much better place with much of the epidemic behind us. That's just kind of what he's projecting. Don't know that for sure, but that is the hopes of Vice President Pence. Uh, Also talked about today, Bill Bryant, who leads the Science and Technology Directory for Homeland Security. They did some lab tests to see um, if there's anything that could weaken the life of the coronavirus or essentially kill it faster. So, kind of have stuff from that here. This is the chart that they displayed. So, as you can see, talking about the half life, for those that don't know, half life is obviously half the life of the virus or the strands of the virus. So, the half life is 18 hours. That means the virus is alive for 36 hours by itself without contaminating someone. Viruses live by they contaminate other cells, infect those cells, and then destroy those cells um, to basically keep themselves living. It just kind of replicates itself through the cells until bodies build up antibodies inside themselves to fight off those viral cells and kill them so that they cannot kill other cells and mutate. That's kind of what causes the death when people can't build up and their immune system can't build up those antibodies. Then the virus attacks all the cells in their body and basically kills all those cells. Without the cells in the body, you're gonna die. So it's basically what it have there. So the half life that it's showing here, that 18 hours at the first line on the surface. So the condition they've talked about, this is like door handles, like stainless steel surfaces and things like that that are often touched. 18 hours half life, so 36 hours is how long that virus can live by itself without another cell basically being food for it. So if you see here on those same surfaces, the first four lines, line 2 and 3 show basically what humidity can do to the life of the virus. So line 2, as you can see, 70, 75 degrees, 80% humidity, brings it down to 6 hours. So that's a third of the life. And then you crank it up to 95 degrees. The test showed that that takes it down to 1 hour. So you're now down to like 1/18th of the virus's original life. And then when you incorporate sun into it as well, so like the summer sun, the UV rays from that, compare line 2 to line 4. That's the same temperature, just adding the sun. So you go from 6 hours to 2 minutes. And then the last two lines are like aerosol, which is basically like airborne, the virus in the air by itself. So in the air, it can live about 60 minutes, but when you incorporate the sun, the UV rays from the sun, it takes it down to like 1.5 minutes. So it's a really big difference. Now, one thing I want to stress personally, they stress this as well. That doesn't mean that you can just run out in the sun and you're not going to catch coronavirus, okay? So it just means that the virus lives shorter amount of time with those stipulations or in that environment, rather. It lives a shorter amount of time, so that way you're less likely to catch it because the virus doesn't live as long. But if somebody's sick and if they're infected with the coronavirus and you're standing next to them, whether you're in the sun or not, they cough. As it showed, okay, in the UV rays, it can make that viral strand that just came out around 1.5 minutes. But if you're standing right next to them in the sun, 1.5 minutes is all it takes for it to touch your hand, and then you touch your face or whatever, and then you're sick too. So it doesn't mean that you can just go out in the sun and you're not going to get the coronavirus. Okay, it just means that once the summer sun is out, the virus isn't going to live as long, and it hopefully will not be passed as easily, transmitted as easily, and then we won't have as many new cases. Basically what they were testing there. So obviously people in warmer climates like Miami are still getting infected and still dying. So you can still get it if you go out in the sun. But that was that was the main part of what the White House coronavirus update was. Then just to give you the numbers for today, this is reported by John Hopkins. So now 856,209 cases in the United States. That is up around 10,000 from yesterday. So about 10,000 new cases. There are now 47,272 deaths. So that's over 600 new deaths in the United States. And then 78,339 people have recovered. So from the number from yesterday, that's over 1,000 more people that have recovered in the United States. One last thing I want to talk about, because this was announced earlier in the week. The coronavirus, so originally they thought that the first deaths from the coronavirus were on February 29th in Washington State. But earlier this week, this was reported by NBC News. Actually, February 6th and February 17th, there were 2 deaths in California from the coronavirus. So they originally thought it was like flu-like symptoms. That wasn't COVID-19 that killed them. But then after further evaluation, they discovered that it was COVID-19 that those deaths were related to. So take that how you will. Obviously, it was killing people earlier than they thought. Probably could have took some better measures if that was found out sooner. But nonetheless, those are the numbers and the developments for today. As always, like I told yesterday, you can get information, full details, and updates on the coronavirus, its developments, the numbers, everything like that. I'll kind of give you a screenshot again. So one place you can go is cdc.gov/coronavirus. This will give you numbers. You can look at how many cases by state, as you see here. But as I said yesterday, as you can see right here, as of April 22nd. So the CDC's website is updated from 4 p.m. the day before. So it's always going to be a day behind, but it'll still give you like a rough estimate of what's going on there. Give you the total cases and stuff as well. But as I said, it's as of 4 p.m. the day before. Another website you can go to is coronavirus.gov. So that is today's update, the daily Rona report. So stay safe, stay healthy. Till tomorrow, Jordan Taylor. See you guys then.